You don't know me, I'm Amanda. I am the founder and director of Well Beyond Breast Cancer, and I'm super excited to have you here for another educational webinar. Today's webinar is everything you need to know about compression therapy. This is a new initiative that we do here at Well Beyond Breast Cancer, where we bring you education directly to the comfort of your home, bringing you knowledge on different breast cancer related side effects so that you're able to better self-manage. I just want to quickly introduce who it is that we are. The Well Beyond Breast Cancer is a nonprofit organization that's dedicated to improving the quality of life of the breast cancer community. And how it is that we do that is by increasing access to breast cancer rehabilitation as well as lymphedema therapy. So the bread and butter of our organization, our main program is our financial assistance program, where we partner with physical and occupational therapists specialized in breast cancer rehabilitation and lymphedema therapy nationwide to provide appointments for free for those who are uninsured or underinsured or just experiencing financial hardship during or after breast cancer treatments. So that is who we are, and these educational webinars are a new initiative that we started this past year. So just a little disclaimer, everything in today's webinar is really just for educational purposes only. If we will have a live Q&A giving you the chance to ask Caroline and myself any of your questions. However, keep in mind, really consult with your own healthcare team if there's specific concerns that you have. So I have the extreme honor of sharing that we have a wonderful sponsor for this educational webinar, that being Juzo. So I know many of you are familiar with Juzo, but Juzo is a wonderful compression garment company, and they are much more than that. They do these wonderful educational webinars, and I'm so lucky to partner with Caroline to deliver this information to our community. And like I said, just help you feel more informed wherever it is that you are in your breast cancer journey, or I know we do have some therapists listening to this call as well. So very, very excited to bring you this webinar. So with that said, I have the great honor of introducing our speaker, Caroline. So Caroline is the National Education and Training Manager for Juzo. And Caroline, I will hand it over to you. And let's hope we don't have any other technical difficulties today. I will be here the whole time, but I will hand it over to you. Thank you so much for doing this and being here today.
Oh my gosh, thank you so much. And it's an honor to be here with everyone today. As Amanda said, my name is Caroline Pinney. I'm the National Education and Training Manager for Juzo here in the United States. I've been with Juzo for about 16 years now. Guys, today I'd like to cover the basics of compression. We will learn the types of compression available and how they work. We'll also talk about the quality of products and why that matters, compliance, care of the product, and some troubleshooting tips. Next slide. Next slide, please. Okay, awesome. So let's get started with that. Compression garments. How do they work and what are we supposed to expect out of the therapy? Next slide. When you think about how a compression garment works, there's three main contributing factors. Go ahead. Next slide. There we go. So we need to think about the compression level. Is that compression displayed in a graduated manner? And then also a big component of this is the containment. And I think that's where a lot of beginners get a little confused. And we're going to go into that. Next slide, please. So first, let's talk about compression levels. So as you know, there are four main compression levels or classes. These are considered to be medical grade compression levels. And what a lot of people don't realize is that there are actually two sets of ranges that equate to the first three classes. And the reason that's important to know is because sometimes when people order a garment, they may be talking about a range that is in the incorrect category. So your made to measure products, something that is made specifically for an individual patient, those levels are listed on the bottom of the screen. And then off the shelf garments are listed on the top. So if you look, for instance, at the class 1, if I were to test a made to measure, a custom made compression arm sleeve, I would need to find a value of between 18 to 21 millimeters for that garment to be considered a class 1. Whereas something that you buy that's considered off the shelf compression, it's going to need to test at a higher range to have the same effect. So that's why you see those ranges. It's my advice when you are ordering a garment, stay away from talking ranges and just look for that compression level. Okay, next slide, please. So the next thing that you need to make sure that you're doing is working with a garment that displays the compression in a graduated manner. So what that means is you want to find 100% of the value of compression most distal on the garment. Then you would need to find a gradual lessening version of that compression as you're moving your way back up towards the top of the body. And that makes sense, right? We're just trying to promote circulation. Next slide, please. So now let's think about that resistance, the type of fabric that your fitter or therapist chooses. So that's really going to have to do with how you present. Where are you at in your treatment phase? What level of compression do you need? The more resistance that a product gives, the more containment, and that's going to give more pressure. So next slide, please. I like to break it into 3 categories. It makes it super easy to use a few analogies. So circular knitted products and flat knitted products are both considered to be products that you use once maximum reduction of the limb has been achieved. They're very different, but they're both considered to be resting pressure modalities. And that, again, that's the type of pressure you want to use just to keep the edema from returning to the limb. So a circular knitted product is kind of like a pair of yoga pants, tight, stretchy yoga pants. And they do have medical grade support, but they are going to conform to whatever is underneath it. Now, flat knitted products, I like to use the analogy of like a pair of blue jeans, a denim pair of blue jeans. So when you put on your blue jeans, it's not going to conform to every lobe and fold. It's going to support it. It might even push any extra tissue up over the top, like the muffin top effect. So although these fabrics are very different, again, they're both used to keep that limb at bay. When you look at compression wraps work a little bit differently. They provide what's called a high working pressure. So they have the ability to be used to reduce the size of the limb or to keep the limb at bay. So compression wraps are a little bit different, and we're going to go a little bit more into that in just a few slides. But those are your 3 main categories. Next slide, please. How do you know which fabric you're supposed to use? Again, hopefully you are working with an expert in the field of compression, and the type of fabric that you use has a lot to do with the containment. So in this example, on the left side of the screen, you will see a patient that presents as a large patient with a lot of lobes and folds and soft, loose hanging tissue. That type of patient is going to need the resistance of the flat knitted garment to support that heavy tissue. On the right side of the screen, you will see a patient that presents with very anatomically shaped limbs. She had a double radical mastectomy a couple years prior to standing in that picture. She does a great job of managing the disease in the lower stages of the disease. So she is doing great, rocking out a pair of circular knitted garments. Next slide, please. So if you were looking for a fun field trip, come to Ohio, which is where we have one of our manufacturing plants, and you can see the machines that make these amazing garments. Our circular knitted machines are made just as the name is, sounds like, it's on a cylinder. So it's a circular knitting machine, and the machine knits around and around in a circular motion. So it produces a product without a seam. Circular knitted products are great because they have some great two-way stretch. You can get circular knitted products in standard sizes, meaning I take your measurements, I look at a size chart, and I can hand you the product in your size. And some of the circular knitted fabrics are available in customized solutions. So that means we are going to make the product specifically for your body shape. Okay, so next slide, please. Flat knitted products. So these machines look very different. So they are very long, about, I'd say 8 to 10 feet long, and they produce customized solutions. So everything that I'm telling you guys is standard in the industry. It's not Juzo specific. I will let you know if there is something Juzo specific. But flat knitted products, by and large, are going to be customized solutions. So they are made specifically for each individual patient. So they can accommodate any size or any shape. Really large patients, pediatrics, patients that have odd shapes, odd sizes, drastic changes in circumferential measurements, patients that present in the later stages of the disease. These are all examples of patients that will do well in a flat knitted solution. Next slide, please. So this is what a glove looks like when it comes off of that flat knitted machine. So you can see it's knit kind of in half. And then we've got the piping on the left side. Next slide. Our talented seamstresses at our Juzo plant are going to fold the glove together and use the piping. So flat knitted products present with a seam. So that's something super important to remember. You always want to look on the inside of a flat knitted garment to make sure that that seam is sewn down nice and flat and that it has two-way stretch. That's going to make sure that you are safe and comfortable in that product. Next slide, please. And I told you we'd go a little deeper into compression wraps. Compression wraps have a more of a short stretch quality. So they emit, again, what's called a high working pressure. Working pressure is the kind of pressure that's used when you're trying to evacuate that fluid out of the limb. So you can use compression wraps as an evacuation tool. You can also use compression wraps. Maybe someone is having trouble donning a traditional compression garment, and they might think a wrap may be easier to don. I see this a lot in assisted living facilities, as well as maybe if someone has home health coming in. You can also use compression wraps if you're having trouble with someone being compliant. So they have a lot of different uses. Next slide, please. So those are the main things to take away when you think about how is that compression derived. It's not just about that compression level. We also need to make sure that that compression is displayed in that graduated manner and the density of the knit. You're not going to need to worry about that. That's going to be a decision that your fitter or your physical therapist is going to determine. They might give you a selection of a few different types of fabrics, but the category is probably going to be based on where you present and what your needs specifically are. Next slide, please. So which one is right for you? Next slide. Remember, there's only one you. And everything about this industry is just it's not black and white. So we have to really think about what we're looking at. Often I get emails from folks and they will send me a picture and say, what do you think that we should do for this patient? And usually, almost every time, I am calling back or sending an email back asking for more information, because I can't just look at that limb and say, okay, here's what you have to do. We've got to know, okay, has this person ever used compression before? What stage? Do they have the swelling under control, or are they experiencing intermittent swelling throughout the day? Do they have swelling when they wake up? What about assistance? Do they have someone to help them put the product on or take it off? Do they have the ability to do that on their own? What about comorbidities? Maybe they have a frozen shoulder or arthritic hands. So we've got to ask questions. You need to dig a little deeper because not everybody is the same. And that's a great thing, right? But in our industry, it's very important to remember everyone has their own story and they are going to have individual needs. So we need to ask questions. Next slide, please. So as you know, when you think about the stages of lymphedema, we have 3 active swelling stages and then one stage that's called latency or subclinical. So let's start off with that. Latency or subclinical lymphedema simply means we know there's been something that has caused a reduction of the lymphatic transport capacity, but the body has been able to adapt and there's no visible swelling yet. So an example of that would be breast cancer treatment, radiation, even chemo. If you have a mastectomy, all of those things can cause damage to the lymphatics. And with that damage, we know the lymph transport capacity has been compromised. But that's not to say that that person is absolutely going to get lymphedema. The body absolutely can adjust, and they may never develop active swelling. But that's what latency or subclinical lymphedema is. When you look at the active swelling stages, stage 1, we have pitting soft edema. So your tissue is soft and pliable, easy to work with. And a patient will find reduction of the limb when they elevate the limb. So if you lift your limb up over your head, you will find reduction of that edema. Stage 2, now even with elevation of the limb, a patient does not find reduction. And now that pitting edema is becoming more difficult. You start to get the beginnings of hard fibrotic tissue formations. Stage 3 is considered to be elephantitis. So hopefully we're doing a better job of catching and treating lymphedema earlier so we have less and less people that evolve to this stage. So stage 3, a patient will experience hard fibrotic tissue. So that can be really tough for them with their activities of daily living. So we know compression garments preserve the size of the limb. They're not used to reduce it, but only to preserve it. Next slide. So let's talk about the difference between dosage and containment. And that can be very confusing. So it's the millimeters of mercury, that's the compression level, versus the type of fabric or material you're using. Next slide. So the dosage, again, that's what is going to be prescribed. And that's the force that's going to push inwards. So that would be your compression level 1, 2, 3, or 4. Next slide. The containment is the material or the fabric that is chosen. And what that's used for is to resist the edema that's trying to push out. Next slide. So when someone has chronic peripheral edema, they're probably going to need a higher containment level. And again, the containment is what is going to manage the edema from returning to the limb. Next slide. So remember, circular knitted products are meant for somebody that presents with an anatomically shaped limb, a limb that still looks like a limb. Typically, you're going to use a circular knitted product when somebody presents in an active swelling stage 1 or 2. That's not always, but typically. Next slide. Flat knitted garments, remember, they're custom solutions. They accommodate any size or any shape. And your specialty items will also be made on a flat knitted machine, like face masks, thorax garments. And again, usually you're reaching for a flat knitted garment when it could be because of the size, or it could be because they're in those later stages of the disease. Next slide. All right, so now that we've learned a little bit about how these things work and a little bit about the dosage as well as the resistance, let's talk about compliance. Go ahead. So like we mentioned, this is a chronic and progressive disease, meaning there's no cure and it will get worse if it's not managed properly. In this example, you'll see a gal with a 7-year difference from the picture on the left to the right. She went to school out of state. She has primary lymphedema, and Mama Bear was not in the picture when she was out of state the way that she was when this gal lived at home. And she will tell you she just sort of like decided to give up on compression. I've worked with this patient and she definitely regrets that decision. You can see she's wearing an off the shelf pair of blue jeans on the left, and on the right, there's no turning back. I mean, we can help her, but she's never going to be back to where she was. So compliance is essential. Next slide, please. So that's where we go with why medical compression. Next slide. Compression is used to prevent the progression of the disease. And it's also, just simply put, it's used to prevent edema from coming back into the limb. And that's super important because, again, you have to manage the edema if you want to properly manage this disease. Next slide, please. So when you think about edema can actually interfere with your body's ability to have an efficient exchange of nutrients and waste. So when you have edema that's left unchecked for a long period of time, it's going to cause skin integrity issues and eventually cause those protein strands to become more hard and fibrotic. So in this example on this picture, you'll see this is supposed to be a limb. On the right side, see all the black in between those cell spaces? That's unaddressed edema. And if it's left unchecked, then the body can't get the good stuff in quickly enough or the bad stuff out. Next slide. So what we call the space between those cells, we call that the diffusion distance. And a normal diffusion distance is 1/10 of a millimeter. Imagine when you can physically look at someone and see a difference in their two limbs, a size difference. That's a big impact on the diffusion distance. Go ahead, please. Next slide. So edema is what is going to increase that diffusion distance. So that's why it's so important to not blow off managing edema, because it will impact your health and well-being. Next slide, please. The local immune responses will be compromised. Nutritional supplies will be compromised. You'll start to see skin integrity issues and possibly infections and breakdowns. Next slide. So that's why compliance is crucial. I always tell people, listen, you probably didn't wake up today and think, today's the day I'm going to see. I'm going to pop those contacts in or put my glasses on. It's something that you do to better your quality of life. Same with a hearing aid. You're using that medical device to make things better. And that's what this compression garment does. You may not see something horrible happen if you skip a day or even two, but eventually it's going to impact that quality of life, because then the edema will return to the limb. So it is a medical device, and you should use it every single day during waking hours. Next slide, please. So what's the difference? Now, this is a really popular question. In the United States, the Lymphedema Treatment Act passed, and with the passing of the Lymphedema Treatment Act, or the LTA, a lot of people were looking for cheap solutions, maybe even going, to Walmart or Dick's Sporting Goods. And I'm here to tell you there's a big difference in the quality of the garments, and the quality matters. Next slide, please. It's not like swapping out, Charmin toilet paper for a generic brand. They honestly just do not do the same thing. You have to be careful. Next slide, please. So a lot of people don't realize this, but here in the United States, there are no FDA requirements that manage the testing of compression garments. So that means that these garments do not have requirements for testing compression class, if the compression is displayed in a graduated manner, or if it's even doing anything. Does it have efficacy? Next slide. So that means anybody can, distribute a compression garment. And we see a lot of this. And I like to call it crap-pression. You have a lot of unethical mass distributors of crap-pression, and they just try to, spit out a one-size-fits-all solution that's probably going to do more damage than good. Next slide. So unfortunately, like I said, there's more bad than good out there. And most of your bad garments are not doing any good. And I've seen them do some damage as well. Next slide, please. So, unfortunately, you really do have to have a buyer beware mentality. You may even see some really pretty garments with a nice story, but that doesn't mean that they're medically effective, especially in the later stages of the disease. Next slide, please. So, the quality does matter. It has a lot to do with compliance and a lot to do with the efficacy. Efficacy. Is the thing working? Does it have an effect on the limb that we would expect? Next slide, please. So these are two thigh highs. And on the left, you will see a thigh high that is supposed to be a thigh high. I don't know whose thigh that would fit on. It's just a straight line. It's like a tube. It doesn't have an anatomically shape. And it also did not test for what was stated on the tag. On the right side, you'll see a Juzo thigh high. And you can see it looks more like a thigh. It has differences in circumferences, and that's what you should see. So you really do have to have that buyer beware mentality. You need to know who you're buying your product from. Next slide, please. So when the Lymphedema Treatment Act, we knew that it was going to pass, we decided to come forward, and the good quality manufacturers decided to create the United States Medical Compression Alliance. And basically, that's kind of like the good guys coming together to help Medicare understand, when you use compression, what options are available. So this is a really important thing. Next slide, please. The U.S. Medical Compression Alliance involves 6 of your main compression garment companies, your manufacturers, and Juzo is one of them. So I want to talk a little bit more about the Lymphedema Treatment Act and go a little bit into, the replacement and some of the things that they passed. And also let's talk a little bit about the care. Next slide, please. So as you know, since the LTA passed, they were very generous. They allow for 3 daytime garments to be distributed every 6 months. So that's really great. We all know that lymphedema patients are at a higher risk for getting an infection. So you really need to have one to wash and one to wear, and then one on deck. And that's why they have the 3. So that's a really great thing. Remember, those garments, you can get new ones every 6 months. And the clock starts ticking after that first garment is dispensed. Now, the other thing the LTA decided to do is allow for 2 nighttime garments to be replaced every 2 years. And that's amazing too, because if you look at some of the recent studies, they have found that really nighttime compression is beneficial for all lymphedema patients. And some of the studies show that the earlier stage lymphedema patients do even better in nighttime garments. They're faring well. So nighttime compression is good. The old saying is, if you're not compressing, it's going to swell. Go ahead and go to the next one, please. So how do you take care of these? Now, this is a Juzo one-off. The only thing that I will say is it's extremely important for people to wash their garments after each use. These are like undergarments. And since the edema that's building up for a lymphedema patient is protein rich, it attracts bacteria. So it's extremely important for people to take care of these garments and wash and dry them. Now, the care of these garments are a little differently depending on which manufacturer you're working with. But I'm going to go into the details on that. Next slide, please. The first thing I recommend, protect that garment. Get a garment bag. We sell garment bags at Juzo. You can use a pillowcase. You could go to the Dollar Tree, but use something. So that's step number 1. Next slide, please. Now, this is Juzo specific. We recommend that you use a mild detergent with no additives. And you see so much of that now, all of your free and clear. So no bleach, no softener, and no fragrance. These additives will compromise the efficacy of the garment. So stick with a free and clear detergent. Next slide, please. For Juzo, we want you to put our garment into the machine and wash it. That is going to clean the garment. And next slide. We want you to put our garments in the machine to dry it. So the reason that we want the garment to go in the machine to get dried is because the heat will actually allow the memory elastomers on the garment to go back the way that they should. So with the heat, that's going to allow that garment to go back to the efficacy that we need it to show. So we want the product to go in the machine and get washed and go into the machine and get dried. Don't use dryer sheets or any softening agents because that's counterintuitive. If you must air dry something, make sure you dry it flat and not over a towel bar. The weight of the moisture will actually stretch out the garment. Next slide. So let's look at some of the troubleshooting tips here. So when you get the garment and you get it out of the box, we call that unboxing it. We're going to also talk a little bit about donning and then, how it should feel. And then, looking for things that you really need to report back to your fitter or therapist immediately. Next slide, please. When you get that garment, it's brand new. Pull it out of the box, stretch it vertically and horizontally. Give it a big stretch. And what that's going to do is it's going to just kind of let those elastomers breathe and stretch out a little bit. So that's number one. You want to pull that garment out and give it a good vertical and horizontal stretch. Next slide. We recommend getting donning gloves. So we sell donning gloves at Juzo. Some people use like dishwasher gloves, if you wash your dishes, dishwashing gloves. Whatever the case, make sure you get some donning gloves that have a nice surface on your palm. First of all, donning gloves will allow you to protect the garment, especially if you have like jewelry or nails. Also, you're going to use those donning gloves to evenly distribute the compression garment. So once you put the garment on, I want you to take those gloves and gently rub from the most distal end up to the top so you can distribute that compression evenly. Next slide, please. You want to make sure you understand the proper placement of the garment. I know that probably sounds crazy, but I have seen so many times I'll walk into like an assisted living facility and I see knee highs pulled up to mid thigh, or the arm sleeve is not pulled up high enough. So we want to make sure that we have a clear understanding of that. So for an arm sleeve, you want the arm sleeve to be pulled up straight all the way up to your armpit. Knee highs should be pulled up to about 2 fingers below the bend of the knee. So just make sure you have a clear understanding of that when you're working with your fitter or therapist, because if you don't put it to its proper place, it can cause issues like binding or a tourniquet effect. Next slide, please. So what is binding? This is actually binding, and that can be caused, again, if it's a bad fit. So if something is too long, it's probably going to bind and bunch down in your crevices. And so that can cause a lot of damage, which is very dangerous for a lymphedema patient. If something is too small, again, that can also cause skin irritation and damage. So don't be afraid. It should have a nice snug fit, but it should not be causing any binding or skin damage. Next slide, please. At Juzo, we recently came out with functional zones, and this is available in one of our flat knitted fabrics. And basically what it does, there's special stitching at either your knee or at your instep, which is where that ankle meets the foot, or up at the arm, it's at your elbow. And part of that is to make the product so it's easier to move around. But the other thing is it really gives you a visual, okay, my knee is supposed to go where this stitching is, or my elbow needs to go where this stitching is. So not only does it provide comfort, but it gives someone a visualization for how far up to pull the garment. Next slide, please. So again, don't be afraid, to report back. You should be working with a certified fitter who has the expertise, but you shouldn't feel pain. It should feel snug. These are medical grade compression garments, but you don't want to see any binding or slippage. If something is falling down, it's probably too large or it's too long. And then again, the binding, that can be very dangerous. Next slide, please. Hopefully today you have taken away some tips for compression, and we want everyone to be a champion with their compression. Listen, I understand it can be a tough pill to swallow when you find out, I need to wear this compression garment 7 days a week, 24 hours a day, or not, sorry, 7 days a week during waking hours and possibly wearing that nighttime garment. So you're in compression 24 hours a day. But we want to give you aesthetic choices, something that you feel confident and beautiful in, and something that's comfortable. Thank you for your time today. And I'm happy to answer any questions if anybody has anything at all that you want more insight on.
Thank you so much, Caroline. So if anyone has questions for Caroline or for myself, I forgot to mention I'm an oncology physical therapist and certified lymphedema therapist as well as being the founder of Well Beyond Breast Cancer. So both of us are here to answer any questions. Feel free to unmute yourself if you're comfortable, or feel free to leave your question in the chat and I will happily read the questions. So giving you the opportunity to ask us any questions that you have. While we wait for questions, Caroline, thank you so much for that incredible presentation. I always learn something new, which is always fun and incredible for myself as well. I just want to bring more light to something that you actually said. I too have seen numerous patients over the years who have ordered compression garments themselves online without any guidance from a fitter or a therapist. And like Caroline mentioned, not all garments are created equal, and it's super important that you are really looking for a medical grade compression garment and you are working with a fitter or certified lymphedema therapist to find what's appropriate for you, because I have seen people wear compression garments that aren't the proper standards and aren't the correct fit, and those garments can actually do a lot more harm than they can do good. And some people don't realize that is wearing a compression garment that doesn't fit appropriately can actually do a lot more harm than managing that swelling. So it's super important to always work with a fitter or certified lymphedema therapist. If you need help finding a certified lymphedema therapist within your community, that is something that we also do at Well Beyond Breast Cancer. We are super happy to connect you with someone in your community. I know that it's sometimes really hard to find us therapists, so we're just here to offer that support as well.
Awesome. I also wanted to mention, I'm like so proud of Juzo as a company. We've always been right in the forefront of making sure that we give people choices, aesthetic choices, like colors and designs. We have tattoo designs for arm sleeve. I mean, it's amazing in the 16 years I've been doing this to see the evolution of that. And people deserve that. If you have a chronic disease that requires you to wear something, you should have those choices. So you guys, if you haven't seen it, please go to our Juzo website and check them out. There's like the cutest tattoo designs. I was just working with an 86-year-old lady, and she got a tattoo design for her affected arm, and then she got over-the-counter compression for her other arm. And she was excited. Like that, if you're excited to wear compression, I've done my job.
I love it. Does anyone have any questions for Caroline about compression therapy or anything at all? Like I mentioned, feel free to leave those questions in the chat, or feel free to just unmute yourself if you're comfortable doing so. No questions? Okay. Well, I just again would like to thank Juzo so much for sponsoring this webinar. And Caroline, thank you again so much for providing all of this content. I know it will be so helpful for many of our community members. I'm very excited to share this webinar in the next few days for a lot of the people who had missed it today live. So I cannot thank you enough.
Oh, thank you so much. It was my pleasure. Thank you for everyone for your time today.
Thank you, everyone. So if you do have any questions for Caroline down the road, or for myself, please don't hesitate to reach out to us at Well Beyond Breast Cancer. Our email address is there. Our Instagram is there. Feel free to send us a DM or email, whatever works best for you. We are always really happy to connect you with therapists, as I mentioned, within your local community, or if you aren't someone who needs financial assistance to access a specialized therapist, whether that's during or after breast cancer treatments, we do also offer that service. So please don't hesitate to reach out. We are always here to help. Thank you so much to everyone again, and I wish you a wonderful rest of your day.